very difficult for many people. I understand that. And we're doing everything we can to help you as a government. Just this week, we announced new measures to help families, workers, and businesses. But even with that help, I know that things remain difficult. And for people who were already in trouble, it's even harder. Staying home, for example, is not always easy.
For some, physical distancing means juggling taking care of the kids while trying to get some work done at the kitchen table. But frankly, that's not everyone's reality. For far too many people, home isn't a safe place to be. For others, it's somewhere they're isolated and alone. And for too many more, they have no place to go at all. Tough times fall first and hardest on the most vulnerable in our communities. But we can change that. We can make sure that no one is left without help. Let me take a moment to speak directly to kids. I know these past weeks have been tough. You haven't seen your friends, you're not able to go to school, you've been hunkered down with your parents, and you're watching the world you know change radically. It's a source of anxiety, it's a source of tension. Maybe there's extra tension in your family. But there are people who can help. Reach out to Kids Help Phone. You can call them or text them. Text at 686868 or call 1-800-668-6868 or go online to kidshelpphone.ca. They are there to listen. They are there to support you. They are there to make sure that you know that you are not alone and help you and all of us through this. No matter where you live, 24 hours a day, 7 days a week in French and in English. Indeed, to make sure that you have the help you need, we're investing $7.5 million for more counselors and trained volunteers with Kids Help Phone. There are people in your corner making sure you're okay. And kids, I want to speak with your grandparents now. Our seniors are particularly vulnerable to COVID-19. We all know that, and it's for them that so many of us are staying home, are self-isolating, are following the rules. But even if they're safe and isolated, this is not easy on them. Maybe they're having trouble getting out to get groceries. Maybe they're feeling particularly alone. Maybe they've already been isolated and this is just an extra degree of stress on them. Well, we've got help for them as well. The Minister of Seniors, Deb Schulte, is announcing $9 million through the New Horizons for Seniors program to the United Way for everything from health check-ins to grocery delivery. In fact, the United Way is already stepping up. Here in Ottawa, they're helping people like you with things like meal delivery. Aujourd'hui,
today, we are announcing new funds for those that need them most. I'd just like to take a moment to speak directly to young people. I know that these last few weeks have not been easy for young people. You can't see your friends, you can't go to school, you can't do all the things that you did before, and you see the world is changing. That's a source of stress and anxiety for you and for your family. Things may not be easy at home either, but you should know that you can always get help and you're not alone. Kids Help Phone is a program that's been in place for a long time to help children. You can call, you can go online, you can text a message as well, and they'll be there to help you. You can send a text message to 686868, or you can call the helpline at 1-800-668-6868. Wherever you are, in French or in English, 24/7, there will be someone there to help you and to help your family. And to do even more to help these kids who need assistance, we are releasing $7.5 million to hire more counselors and volunteers. And for the grandparents of these children, well, we're thinking about you as well. We know that COVID-19 is hitting seniors harder and is more of a risk for our seniors. So you are probably even more isolated than you may be normally. Maybe you're having trouble getting your shopping done or meeting your own personal needs. But I just want to say that we will be providing help to you as well. To help seniors who are vulnerable, we are offering $9 million to United Way through the New Horizons program for seniors. That will allow this organization to provide a whole range of services to seniors, whether it is a health check-in or delivery services or meal deliveries. In a country like Canada, no one should be abandoned. And to help those people who are homeless or people who are fleeing family violence or sexual-related violence, we are allocating $200 million to shelters.
We promise to help everyone get through this tough time. If you can't go home because it isn't safe or because you don't have a home, we're not going to forget you. We'll work with the organizations you rely on, and we'll have your back. Earlier this month, we committed $200 million for shelters. If you need to get away from domestic violence or violence because of your gender, if you need somewhere to stay, there are places you can go and be safe. This new funding is already having a huge impact on support for you. Just take the shelter in Toronto that can now rent additional space to isolate residents with COVID-19 and keep everyone safe. And we're going to keep working with charities and nonprofits on this. On that note, I want to recognize the incredible people who work and volunteer in their communities through these groups. I know it's been hard lately, not just because more and more people need your help, but because you're struggling to keep doing this work for marginalized and vulnerable people during a public health crisis on a scale that Canada has never before seen. Soon, I'll have more to say about how we can make sure you're supported and can help keep helping Canadians who need it most. But the bottom line is this: whomever you are, whatever you need, we're here for you. And if you're fortunate enough to have a little extra to spare right now, I'm asking you to join in and be part of the solution. Please donate to your favorite organization or find out how you can volunteer in your community. Even working from home, you can make a real difference in the impact an organization can have. As an individual, a family, a company, think of how you can lend a hand to help others through this tough time.
We all have a role to play to ensure our health and safety. As we often say, it's very important for young people to continue to keep a distance of 2 meters from others, stay home, and avoid busy places in order to stop the spread of COVID-19 as soon as possible. I know it's even harder to stay home during the weekend. Sometimes you can feel very alone, but don't forget that we're all coming through this difficult time together. And you just have to look around you to see those signs of solidarity right across this country and around the world. People are showing that the best days are still ahead. And if you're in Montreal tonight, look at the Champlain Bridge. It will be lit up with colors of the rainbow.
I know these are hard times, but I also know that we're going to get through them together. Merci beaucoup tout le monde.
Thank you. We'll now go to the phone lines for first question. Please keep it to one question and one follow-up. Operator.
Thank you. Merci. La première question nous vient de Raymond Fillon, TVA. À vous la parole.
Good morning, Prime Minister. I'd like to talk about something different. Have you received any demands, or are there any discussions with respect to having the Army intervene, particularly in Quebec, where it's possible of shutting down access to the City of Montreal in the coming days? Well, we know that the situation is evolving every day, and we're ready to consider all eventualities. We know that Canadians are aware that the Canadian Armed Forces will always be there to help Canada when Canada needs help. They are there to serve, but for now, we have not had any specific requests of that, and there's no plan at this time to carry out operations in Canada with the Canadian Armed Forces.
Follow-up, right?
You said on Friday that you intend to remain at home even though all of the family is in good health. Is that to give an example to others? Because can you really be as efficient in leading Canada during this time of crisis by working from home? Obviously, we're very aware of the fact that Sophie has now received the all clear. She no longer has symptoms, and she went to Harrington Lake with the children. But I continue to work from here, as we're asking many Canadians to do. But the fact is, I was in the same house with someone who, until a few days ago, had COVID-19. And therefore, the countdown will continue, because I could theoretically have caught the virus even just a few days ago. So I will remain in isolation. This is something that Health Canada is recommending, and of course it's something that we are asking everyone else to do. We're saying to stay home, we're saying to people to stay home when they can, and as you can see, I continue to work every single day from home. We are able to coordinate what needs to be coordinated and do the necessary work.
First of all, I'm very happy, as many people were, to see that Sophie has been given the all clear. It's been a few days since she's been symptom-free, and obviously I want to thank everyone who's sent messages of support. She's taken the kids to Harrington. I'm going to continue to stay here to do the work that needs to be done. And if you think about it, people are wondering why I'm still in isolation. Up to a few days before she was clear, I was still sharing a roof. We were being careful, but sharing a roof with someone who'd tested positive for COVID-19. So I have to continue in isolation in order to be sure that we're following all the protocols and the recommendations by Health Canada. The work that we're doing continues as a government. There are lots of companies and organizations around the country who are discovering that you can do an awful lot of work via telephone, via video conferences, and that's exactly what I'm doing, and I will continue to do it, as so many Canadians are as well.
Thank you. Next question, operator.
Merci. Thank you. The next question is from Mia Rabson, the Canadian Press. Your line is open.
Hi, I'm wondering if you could talk a little bit more about what aid and help you will be providing to charities. I know several hundred of them made a plea last week for help to be able to continue. I think you hinted that there is something coming. Can you give some more reassurances that the charities that are being so relied upon right now will get some help?
Today we have announcements for charitable and nonprofit organizations specifically that have been doing a great work helping out our youth and our seniors, but we recognize there's much more to do. Not only are organizations in the charitable sector and the nonprofit sector doing incredibly important work during very difficult times, they're also in many cases seeing their donations dry up and are very worried about their capacity to continue to do the work they're doing. That's why we're working closely with them, and we'll have announcements to make in the coming days about how we're going to ensure that they can continue to do this incredible work that is so important for Canadians.
And a follow-up, Mia?
Yeah, I'm also wondering, are you concerned at all that you're putting too much pressure on airline staff, check-in staff, people at the train stations to screen people for COVID-19?
We already know that an awful lot of people are not traveling, have listened to the recommendations to stay home, to avoid non-essential travel. This is extremely important. And from the very beginning, we told people that if you have COVID-19 symptoms, you need to stay home. You should not travel. You must not go out. That's going to continue to be the instructions we give, but we've also asked airline and train staff to ensure that nobody with symptoms boards their planes or trains.
Thank you. Next question, operator.
Thank you. Merci. Next question. Prochaine question. Lina Dib, La Presse canadienne. À vous la parole.
Oui, bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. Just along the same lines, you say that you don't need the Canadian Armed Forces for the time being, but do you not think that very soon that might be helpful and necessary assistance, particularly when we see what's happening in Quebec, in Montreal, which is a big part of the province, and so that people stop traveling? Well, the Canadian Armed Forces will always be there to help people who need help. We are ready and we're looking at various scenarios through which we could provide that additional help. But we're not at that stage yet. We will continue our discussions with the provinces and with the various regions of the country to ensure that we can do what is necessary. We are not shutting the door on any possible scenario, but we are making decisions as situations arise. And my next very brief question is, should we start counting your 14-day period from today? Well, I think that's one way of counting it, maybe a few days less, because Sophie stopped having symptoms a few days ago. But we will keep you aware of how long we will continue to hold these press conferences.
Thank you. One more call. Operator, please.
Merci. Thank you. Next question, Alex Boutillier, Toronto Star. Your line is open.
Good morning, Prime Minister. You announced a whole lot of different, funds and measures for small businesses, but a lot of small businesses are having trouble navigating through what you've announced in terms of tax deferrals, wage subsidies, credit availability, that sort of thing. Groups like the CFIB are trying to help them navigate this, but are you considering anything from the federal government to make it easier for people to access the funding that they can access and getting the funding to the right people?
We are doing an awful lot of things that have never been done before by any government in this country. There's never been a reason to. And as we're developing new policy solutions, new ways of helping out people so that we can get through this time and come out the other end of it stronger than ever before, we need to really figure out both what those things are and to ensure that people are going to be able to access them. We are putting out as much information as we can about the different options, and I recommend people go to Canada.ca to be able to find more information about it. I know there are organizations, whether it's the CFIB or banks themselves, that are giving advice around these new measures we're coming in, but we're going to continue to communicate as best we possibly can so that everyone is able to access the help that's there for them, even as we create new ways to help people. I recognize the challenge, and we're going to continue working on it. Okay.
And Prime Minister,
juste une seconde, Alex.
I recognize that we're doing a great many things that are new, we're introducing new programs, and that this can be difficult for people to find out the help that they need or to navigate these new programs. That's why we will continue to try and provide all the necessary information to Canadians and businesses so that they can access the help that they deserve. At the same time, we will be working with other organizations and the banks as well to ensure that information about the assistance that is available can be accessed by those who need it.
And your follow-up, Alex?
Prime Minister, there have been numerous reports that prisons are of particular concern. Prisoners are concerned about the measures in place to protect them from the outbreak if it reaches prisons in Canada. Well, what do you say to prisoners who are concerned right now that they're dealing with one bar of soap per week and no other countermeasures?
We are very concerned about the fact that our correctional institutions could be places where there could be greater vulnerability to COVID-19. That's why we've been working very closely with Corrections Canada, and I know Minister Bill Blair, Public Safety Minister, will have more to say on this. This is something that we are digging into very carefully because we need to make sure we're keeping everyone safe in this country. Okay. Je reconnais que nos institutions de Correction Canada
that our correctional facilities are more vulnerable than other facilities to the outbreak of COVID-19. So we will continue to work with Corrections Canada and Minister Blair to ensure that we're doing whatever is necessary to keep everyone safe.
Thank you. We'll now go to questions in the room.
Ian Wood, CTV News. Prime Minister, this morning you made a small announcement for with regard to seniors giving money to charity groups there. But what about those that are on fixed incomes, seniors who have watched their investments and their retirement savings dwindle away on the market? Are we going to see any increases to CPP or other provisions for them like you've offered to workers and small businesses?
Our focus right away has been figuring out how to ensure that we can replace sources of income and revenue that have been lost because of COVID-19 for so many Canadians across the country who were relying on their paychecks to get through from week to week until this actually hit. But we recognize that seniors are facing greater vulnerabilities, and we are looking carefully at measures to be able to support them through this tough time as well.
Okay. And the Dutch government has sent back 600,000 masks to China that they deemed were defective. I'm wondering, when will we receive the masks that China has said they're going to send to us, and what assurances do we have that they will be effective? And have we seen a thaw in our relationship with China in the course of this crisis?
We will be receiving equipment, masks and gloves and gowns from China extremely shortly in the coming days. And at the same time, I can assure people that Health Canada has very strong procedures for evaluating, for ensuring that what we get is up to the necessary standards, and there will be no corners cut on this one. We need to make sure that the equipment that our healthcare workers rely on to keep them safe as they keep us safe is of a quality that is going to actually do the job. And we're going to continue to engage with the world and try to work collaboratively through this difficult time. It is a global pandemic, and countries need to set aside their differences and work together to get us through this as best possible, and that's certainly the approach that we're taking.
Abigail Beeman, Global News. Prime Minister, in the case of the Quarantine Act and also in the case of the measures announced for travelers yesterday, there's been no clear information about enforcement for those who break the rules. And yesterday in Ontario, we saw a snitch line for price gougers. I'm wondering if you can provide more information about enforcement in general, and also wondering, are you encouraging Canadians to report other Canadians who aren't following the rules to local authorities?
I think, first of all, it's really important that we all follow the rules. What we do today, what we've done over the past few days, what we will be doing over the coming days will have a direct impact on whether or not Canada is able to make it through this crisis in the best possible way. It'll have a direct impact on our healthcare workers. What we are choosing to do right now, these weeks, will affect deeply whether and how we get through this crisis and get out the other side better. So I really impress upon everyone the need to self-isolate, to follow the rules, to make sure that we are not putting ourselves or our neighbors or our communities at risk. Health Canada does follow-ups with people in terms of respecting quarantine. That's an important part of what we do. And I would really encourage Canadians to continue to spread the message, share with each other how important it is to continue to stay home.
I'd also like to ask you to respond to reports that we're hearing about how truck drivers deemed essential workers are being treated when they cross the border, not having access to washrooms or restaurants, and some just being made to stay in their trucks.
We are very concerned with the need to continue essential services, and that includes obviously supply chains that are so important for keeping people fed, keeping people with the medications they need through this difficult time. We continue to work with folks at the border to ensure that the smooth flow and respectful support for these essential workers happens at the same time as we're ensuring safety for our citizens. It's always a challenging balance to establish, but we need to keep working to try and make sure that we can continue to get these essential goods while people are taking risks by continuing their essential work.
Bonjour, Monsieur le Premier ministre, Christian Noël de Radio-Canada.
I'd like to come back to what you said 2 minutes ago with respect to scenarios involving the CAF, particularly in Montreal. Can you give us more details on that? Well, from the very beginning, we have been preparing based on various scenarios. Places where COVID-19 will hit much harder, or various regions that might be experiencing particular difficulties. Our Canadian Armed Forces will always be there to help Canadians, and I know we have sent them to help when flooding has occurred in the past. They will always be there for that. And we will continue to work with the regional and provincial authorities and the City of Montreal and cities right across the country to respond to emergency situations that could arise. But we will not theorize before we get to a time where we have to move forward with more extensive measures. We are taking things one day at a time, but we're prepared for any eventuality. And could you talk about specific scenarios? Can you say whether this would apply only to Quebec or whether there are other provinces who have been discussing this as well in terms of bringing in the army? Well, we will always respond to any request from a province if they want help from the federal government, but I can't say which one would or would not. But we will be there to meet any needs expressed by Canadians or the provinces to keep everyone safe during this difficult and exceptional period.
Thank you. We have time for one more question.
Ashley Burke, CBC News. Prime Minister, there are towns and there are cities across the country who are preparing arenas and community centers to prepare them into makeshift hospitals if needed. What does that tell you about where we are in the arc of this crisis? And as well, what does it say to Canadians about their hospitals' capacity?
I think it's a message that we are preparing for every eventuality. We are hopeful that the behavior that people have engaged in will keep numbers to a manageable level of people affected who need hospitalization, and that is why we are working extremely hard to encourage everyone to stay home and to not risk spreading this virus further. That is how we will control the spread. Our healthcare systems are designed to function close to capacity in normal situations. Day in and day out, we need our hospitals to be able to handle normal surges, whether it's during flu season or after an accident or an illness. We have a health system that works pretty well to handle the needs in regular times. These are not regular times, and therefore it is appropriate and necessary that we look at at how to expand our health system to handle unprecedented numbers in an unprecedented crisis. And I want to commend all the people who are looking at alternatives that we all hope we won't need, that indeed we will not need if people continue to take seriously the directives and stay home and self-isolate. But it is simply responsible for us to be thinking about worst-case scenarios and preparing for them just in case we do need them.
There's been a huge wave of snowbirds and spring breakers returning to Canada, and there's a potential that we're going to see a surge because of that. How prepared is Canada's healthcare system to deal with that surge?
This is why we are impressing upon everyone how important it is that if you return from travel, that you isolate for 14 days. It is extremely important that everyone isolates. And there have been a few questions recently about, well, does that mean I can go for a walk if I keep separate from people by 2 meters? It's very simple. According to Public Health Canada, you can go for a walk unless you have tested positive for COVID-19, unless you have symptoms of COVID-19, or unless you have returned from overseas or outside the country within 14 days. And when you do go outside, make sure, if you don't have any of those three categories, make sure that you are keeping your distance. Don't gather in groups in parks. Keep those distance. And if you are in quarantine or self-isolation and you need some fresh air, open a window or step outside onto your stoop if that's a private place. But really, we need people to be abiding by the rules that public health has put out, particularly people who've returned from travel outside the country.
But can the healthcare system actually deal with the surge?
We are ensuring that we're able to deal with this surge. People are putting emergency measures in place, but we are hoping that there won't be a surge because we have seen other areas overwhelmed, even if they have strong healthcare systems. That's why it's so important that everyone abide by the instructions given. Merci tout le monde. Bonne journée.
All right, and that is the Prime Minister of Canada giving us yet another